So welcome to today's segment. I'm Dr. Nina Tayyib with Los Angeles County Department of Mental Health, and I'm a clinical psychologist. And with me here today is Kanchana Tate, who's a licensed clinical social worker, also with LA County Department of Mental Health.
Today we'll be talking to you about infant and early childhood mental health. So Nina, can you please share with us what infant and early childhood mental health is?
So infant mental health is a field that focuses on the mental health and well-being of infants, and that's actually from ages birth to 5. I think a lot of people in our society think that babies are just there. They are not thinking or feeling or really taking in their environment, and really nothing could be further from the truth. What we know in our field, as well as just scientifically, that this is a time of tremendous growth for infants. They're growing physically, psychologically, emotionally, their brain is developing. So there's a lot happening, and they are actually taking a lot in. It is also impacting them. So Kanchi, what are some factors that impact infant and early childhood mental health?
So the attachment between the infant and the primary caretaker, so that could be the mother or the father, can help the social, emotional, and cognitive development of the infant. So when you have a primary caretaker who is predictively responsive, so when the baby cries, they go over to the baby, they are talking to the baby, they're interacting with the baby and trying to figure out what are the needs of the baby. And what the baby starts to figure out is, I can trust that somebody, when I cry, somebody comes and takes care of my needs. And that really helps them feel safe and trust their environment, and that helps facilitate them wanting to be curious and learn, and helps in brain development. However, if you have a primary caregiver who's really overwhelmed by feelings of depression or stressors, and there isn't another caregiver to step in, their ability to interact and identify the emotional needs or the physical, biological needs, infant can be compromised. And so then you see the impact on mental health on the infant, and that manifests itself inability to sleep, so their sleep cycles are interrupted, their eating has been interrupted. In toddlers, you may see tantrums that last for a lengthy amount of time. So if you are seeing these types of behaviors, it's important to seek out help and find somebody who's an expert in the birth to 5 field, so that they can help you and the baby figure out what's going on. Is it an emotional issue, or is it a medical issue that needs to be tended to?
So Kanchi, you mentioned that some ways that babies may express that they're going through some stress is through crying. What is considered normal crying and what's considered excessive crying?
It's important to know the difference between excessive and normal crying. When we say excessive crying, the research shows that excessive crying is really quantified by at least 3 or more hours of crying a day for 3 days a week. And crying can result in a lot of family conflict. And what you want to do many times is to have a crying plan, so that there's a well-regulated adult that can tend to the child, especially when there's excessive crying. So maybe mom takes certain hours of that crying session, and then grandma takes certain hours, so that there's support, because the infant always needs somebody who's regulated to nurture them.
First 5 years are a time of tremendous growth and change, whether it's emotionally or socially or cognitively. Babies' brains are developing, their bodies are developing, and their relationships are developing. So it's important for that parent to also take care of themselves. Again, a big part of infant mental health, because they rely on their parents, right, and their caregivers for their well-being. So if the parent isn't taking care of themselves, or they're experiencing mental health issues, it's really important, and they're being a good parent to themselves and to their child by addressing that. So thank you for joining us for today's segment. We hope that you have learned some information about infant mental health and the fact that babies do experience a lot of things, as well as physically. And it's really important for their environment and the people in their environment to be loving and supportive, but also get the help that they need if they are suffering.
If you or someone you care about needs help, call the Los Angeles County Department of Mental Health 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.